In this video, we will be talking about golfer's elbow, otherwise known as medial epicondylitis. That's a term that your physician or doctor might use, but for this video's sake, we will be calling it golfer's elbow. If you're watching this video, I hope that the educational printout was of value to you. During your first visit with your therapist, they might have made you a wrist cock-up orthosis or splint to help relieve with your golfer's elbow symptoms. They should have checked off on the printout educational material that you received on your first day when they wanted you to wear this orthosis or splint, whether that is at all times, nighttime only, or any other time of the day. These splints can be washed using cold water or wiped with an alcohol pad. If these splints are washed with warm water or hot water, they can be remolded into a different shape and it would fit incorrectly. Next, we will be talking about prefabricated braces. These items can be purchased to help with your health management of golfer's elbow. These items can be purchased online, whether on Amazon, or can be purchased in a nearby store, whether that's a Walmart, Rite Aid, CVS, whatever might be closest to you. These braces are considered to be counterforce braces, and they can relieve with your golfer's elbow symptoms. You want to wear this only during activity, and you want to wear this type of brace loose enough to fit one finger in between the skin and the brace itself. You want the padding to be on the inside of the elbow joint, right where the muscles are that affect golfer's elbow. So what is golfer's elbow? Golfer's elbow is also termed medial epicondylitis. That is the correct medical term, but it's also called golfer's elbow. Golfer's elbow is considered to be a tendinopathy of the tendons that bend your wrists and fingers. This tendinopathy is a degeneration or a breakdown of tissue in this area. Tissue meaning the muscles and tendon on the inside of your elbow joint. And that's where these tendons are located, as you can see pictured to the right. You may be experiencing one or more of the following symptoms with your golfer's elbow diagnosis: pain on the inside elbow joint, decreased grip strength, pain with resisted flexion. What resisted flexion is having your forearm on the table. Your therapist might have done this during the first visit of your therapy session. You would have the hand on the table, the wrist bent, so your wrist should be palm facing up, and then you want to bend your wrist toward you, and the therapist would push down, and your hand and wrist would have to withstand the force of their hand. If you have pain with this, this is a sign and symptom of golfer's elbow. Pain can also move down the bottom side of your forearm and wrist depending on how severe a person's tennis elbow is. The common age group for this condition is 40 to 60 years old. It's important to know the cause of golfer's elbow so that you do not make your symptoms any worse and so that you can begin the process of recovery even faster. Golfer's elbow occurs with overuse or forceful wrist flexion. So again, wrist flexion, your hand is going to be bending downwards. If you imagine it out in front of you, your fingers are going to be pointing towards the ground, and in that direction will be flexion. As we age, the following decreases: range of motion, strength, and endurance. These factors can affect the muscles and tendons on the palm side of the forearm to contribute towards developing golfer's elbow. So that's something to keep in mind as we age. So a common question is, when will my golfer's elbow go away? So golfer's elbow is different for everybody, so it's hard to pinpoint an exact time, but golfer's elbow symptoms can last up to a few weeks to a full year. Treatment usually lasts on average 6 to 8 weeks, although it could take a little bit longer to have a relief in symptoms. Healing times vary for everybody. This slide will talk about modality use and its benefits, specifically the modality use of heat. Heat can be in the form of a hot pack, and it can help relieve with your golfer's elbow symptoms. You can create your own hot pack by filling a bag or a sock up with uncooked rice, heating it up 30 seconds at a time until it is warm. Then you want to apply heat for 10 to 15 minutes with 2 layers of towels between the skin and the heat source so that you do not get burnt. Benefits of heat include the following: pain relief, an increase in blood flow, which in turn promotes healing, so the more blood flow in an area, the faster that area will be able to heal. It can improve extensibility, or in other words, it'll loosen up the muscles in that area, and it can decrease stiffness. So activity modification will be a big part of the process of getting rid of your golfer's elbow. It'll decrease your golfer's elbow symptoms. You might have to do some activities a little bit differently, but here are some tips for carrying objects with your golfer's elbow diagnosis. You want to have your palm facing downwards or neutral, so facing down as pictured in the top right, those two pictures, or neutral, pictured in the bottom right. You want to keep your elbow bent, preferably at a 90 degrees. The more bent your elbow is, the less stress on the muscles and the tendons that are affected with golfer's elbow. You want the object that you are carrying to be held closer to the body. The closer to the body, the less stress, again, on those muscles that are affected. You want to avoid carrying heavy objects, avoid repetitive gripping and twisting if possible, and take frequent breaks when needed, whether that is 5-10 minutes every hour of what you are doing if necessary. This is the home exercise program, part of the video for your golfer's elbow diagnosis. With this is called our wrist flexor stretch. You want to straighten your arm out in front of you. You can have it lying on a table, hand and wrist off the edge of the table. You want to use your other hand to bend your wrist up as pictured to the right. You want to give a 10-second hold, or whatever amount of seconds that was on your printout, your educational printout that you received during your first day. Next, we have our eccentric wrist flexion exercise. With this, the weight is a 5-pound weight in the example in the pictures, but you are going to use whatever weight that was marked down on your educational material printout. First, you want to have the weight in your hand, the same side as your injured elbow, with the palm facing up, lying on the table with the wrist and hand off the edge as pictured below. You want to bring the hand holding the weight up with your unaffected hand, like pictured in the second picture. And then you want to move the hand holding the weight down very slowly as pictured in the third and fourth pictures, without the other hand holding it.